The Alternative Blend is made possible through the generous underwriting support of the Green Solution.
Hi, everybody, and welcome to The Alternative Blend. I'm Shelly Maxwell, your host, and I am so excited for you to meet my first guest. I probably have talked to her more before the show than any other guest that I've ever had on, and I just absolutely adore her. I think you will too, and I'd like to welcome her to the show. Welcome, DQ.
Hello, how you doing,
It's
Shelly?
good to see you.
It's nice to see you as
thanks
well.
for coming in today.
Awesome. No, I appreciate it. Thank you.
We spent so much time on the phone. I feel like I know so much about your story, so I've got to be careful not to interrupt and let you tell it yourself. But we're going to tell both your professional and your personal story that I think is really, really compelling. But let's start with your professional. You're a nurse.
Yes.
Tell me your background.
So I am a registered nurse. I've been working in critical care and trauma for the last 6 years across Virginia, Texas, and now Colorado.
And you're new to Colorado. You're new to Denver.
I am.
You've been here how long?
2 years now.
2 years. So tell me a little bit about what it is you do. You work in critical care. You work in ICU?
I do. So, I see a lot of things professionally, and it's very interesting because this is the first state where I've worked at where cannabis was legal. But I'm a nurse that also advocates for cannabis. Mm-hmm. Doing what I do, I know that there is a time and place for all kinds of medications, and I deal with medications on a totally different scale.
Sure you do.
So if I have a patient who has experienced a trauma, like just freshly came out of their windshield, their car, let's say they had some form of major surgery, this is when I see you. And this is when medication that I deal with on this kind of scale becomes an issue. If you did not have a chemical dependency on any type of drug before I met you, you have one now.
Wow.
There's times where
there really is an epidemic.
There is, and as the more I see it, the more apparent there is that there is definitely a gap. There's an issue in healthcare. Mm-hmm. There's times where I've given up to 250 mics of fentanyl an hour over days to a patient, and because it was clinically necessary in order for them to be able to tolerate the amount of pain that they were going through at that time. Mm-hmm. But if you did not have a chemical dependency on an opioid before I met you, you do now. And then once you get better, we send you home. And then this is like, what do you do with that?
Well, then the care stops, right? They're at home and they're dealing with this on their own.
And then that dependency then could later on turn into the addiction part. Mm-hmm. And then what we see then as professional when there's these accidental overdoses, where it stemmed from, when did you start taking these drugs? Oh, I was in a car accident, or I broke my leg, or I had surgery, and then people are not necessarily wanting to feel pain. Well, pain is a part of life. If you feel pain, that means that there's healing. But, it's when people don't realize or understand that there is a chemical dependency addition to then that turns into potentially a straight addiction. And
so you advocate for maybe using cannabis in clinical settings, right? And that's not happening yet.
No. And then as a nurse that works in this state, I can't even talk about it, because there is a time and a place for opioids. Okay, opioids is what you need acutely. Long term, you're definitely going to need an alternative if you're not able to overcome or live with that pain.
And it's illegal for you to talk about it in a clinical setting?
It is.
But that must be so difficult because from a personal standpoint, and we'll get to that in a minute, that can really make a difference in someone's life.
It does, especially when I know that there is a lack of pain management, especially when I know that I'm dealing with a patient that has non-compliance, but then also the non-compliance, there's a back end to it where there's maybe a mental illness with addiction. These things go hand in hand, and being in this state where the rates are extremely high for addiction, for opioid abuse, for mental illness, for suicide. And I can't even speak to something that is legal for not just medicinal but recreational purposes.
Right. That's
here.
That's the crazy part. I mean, you can understand it. Maybe we're having this conversation in Indiana, but we're here in Denver, Colorado, where it's legal, and yet you as a clinician aren't at liberty to speak to it.
No, only if the patient asks first, and then even then there's just a lack of education. Yeah. And then that's where I really have gone out of my way before, but now have really gone out of my way to seek that education, not just for my professional role as a nurse, but then my personal life and how it has affected me and how has it affected my family and then my views.
This is exactly where I'd like to head, which is tell your personal story, because it is incredible. You were married for years. He's no longer your husband,
Right,
but
we were married for 10 years.
For 10 years, but tell me what you went through. He was diagnosed with cancer.
Yes, so 2016, November 1st, right after Halloween, my then husband, at age 33, we were just trick-or-treating the night before. He went to the emergency room the next morning for a bellyache. Okay, you understand that was the 1st of November.
And I might think that's just because I had too much Halloween candy.
And that's, we were thinking, plus he didn't feel so good, but I'm just like, just go to the emergency room. It's whatever. He went. But he didn't come home. He's like, yeah, they're admitting me. I'm like, that's odd. He was never a sick person. And he was like, yeah, my white count is, 75,000. And I'm just like, okay.
As a nurse, you know that.
Just way too much. Went up to the hospital, let's just say by the 3rd of November. So the 1st we went in, by the 3rd, this hospital shipped us over to another hospital. Okay, there's a whole team waiting on us. It smelled like I could smell the stench, the death on him. I really could, because that's what I deal with.
Right.
By the 4th was a Friday, and it was at 10-something at night. There were more physicians in that room than I ever have seen professionally.
Oh my goodness. And as a nurse, that's saying something.
Too much. But I just knew the labs. He had no kidney function. He was requiring oxygen a whole lot. His blood pressure was tanking. He was in a bad way. And I'm like, this sounds like cancer. It really does. But I'm an ICU nurse. I'm a trauma nurse. Okay, when I get a cancer patient, at this point, they're too sick to do anything. It's about just doing what I can to get them in a way where they are even physically stable enough to do any form of chemo. But I have trauma services in our room. And I'm just like, why do we even have this person in our room? And they were just like, well, we're afraid that we're not sure what it is, but it looks like a very rare presentation of sporadic Burkitt's lymphoma, and it's also in his bone marrow. And I'm just like, what are you talking about?
Because we're running out of time. Tell me, net, he was given a survival
rate of 10 to 15%. Like, you don't understand, 10
to 15%.
And then that was on a Friday night. They told us, and, I don't know what was coming out my mouth, but they started chemo the very next day. 10 different chemo drugs. 10 nonstop chemo infusions, chemo injections in his spine twice a week. For 5.5 months.
Oh my goodness. For 5.5 months?
Yeah.
Every day?
No, every day chemo with maybe a couple of days of break. But it was literally just to flush that chemo out, to start a new sequence, and still injecting in his spine. And what I didn't understand is just like the amount of toxicities that was in chemo, but the pain that these patients feel, and this is what I know now, it's not a pain where if you cut yourself, that pain's right there. It's a pain where they can't explain it. And they started pumping him with opioids. I already knew what was going on.
Of course you did.
And this is in a state where this is not legal. You're telling me my husband's going to die. We've been married at that point 8 years. We have a 6-year-old child. No, he's not. We're not doing this. I was making cannabis butter and putting it on everything.
Were you?
On everything, making Rice Krispie treats. And what, they were trying to figure out what was going on, but then they kind of knew, he's getting fat on chemo.
You're doing something right.
Yeah, his skin was so pretty at times, so very beautiful. And I'm not saying that cannabis cured it. It definitely managed his symptoms. We didn't have as much nausea as some others. We did have complications, as do anybody with it, especially with the aggressive kind of cancer that he had. But he was in full remission within 6 months.
That's incredible.
Full remission.
So really, at the end of the day, while you don't think cannabis necessarily cured him, it helped him mitigate all of those things he was going through with all the chemo.
Right.
It helped him gain weight, because that's an important piece. So,
yes.
So many cancer patients with
maintain
chemo.
Nutrition,
yes.
maintain just ability to do anything, just maintain to work through the process.
Yes. And so as a result of this, and not just this, but because of your professional career and this personal experience, and by the way, he's alive today.
Yes, he is. 2 years full remission.
That's incredible. And that is absolutely incredible.
Remission.
So the combination of this personal and professional, it led you to be a part of a nurses group.
Yes,
Tell me about this
the
organization.
American Cannabis Nurses Association.
I'm sorry, I stepped on it. What is it?
The American Cannabis Nurses Association.
Okay, and
where we just advocate for the rescheduling of cannabis, education of cannabis, and the use of cannabis as an alternative medication to patients that are dealing with chronic illnesses and pain, in an alternative way to even recreate.
Well, I have to tell you that the combination again of the personal and the professional that's led you to be such an advocate for cannabis is a very strong story, and I really appreciate you sharing it with us.
I appreciate you allowing me to share it with you.
You come back and tell us
Absolutely.
more. She has more to her story, and I want her to come back and see us. You will sometime soon.
Absolutely. I'm looking forward to it. And thank you, Shelly.
Thank you so much.
The Alternative Blend is made possible through the generous underwriting support of the Green Solution.